June 1st. Hopefully have a better month in June than we did May. It's been a wild ride this weekend. Um, so in light of all the things that have been going on, I thought we would talk about something nice this morning. And so really what we're going to talk about is oxytocin. And if you've never heard of that, that's okay. Don't be surprised. It is used most commonly, you know it as the prescription medication for induction of labor and is involved in labor, and it's called Pitocin, or people call it pit drip. I've used it many times. Good morning, Eileen. However, as a few years ago, I got looking at this from a different angle. So oxytocin is a hormone. It's a 9-peptide hormone, or a nanopeptide. Morning, Amanda. And it can be used for a variety of things. Unfortunately, most physicians don't use it. It's been kind of in the realm of obstetrics for years, but oxytocin can be compounded into different modes of administration. So it can be taken as a sublingual drop. It can be taken as a cream. It can be put into a cream medication for vaginal atrophy, and it can be used as a nasal spray. And that's the one I have the most experience with, I guess. So what is oxytocin? Well, it's known as the love hormone. It's also known as the cuddle drug. But it does have to do with initiating uterine contractions during childbirth, and it also stimulates the flow of breast milk. That's what most people know about oxytocin. So there's fairly little curiosity about using this for other means or treatments or help until probably, I'm going to say 8 to 10 years ago, maybe longer. I didn't quite look up how far back research on oxytocin for other uses were, but the first time I saw this was from a website, Belmar Pharmacy, who has been compounding oxytocin as a sublingual administered lozenge, I guess, and they kind of opened my eyes up to a whole lot of possibilities. So oxytocin was first described in 1906, okay, and it was named for the Greek words for quick childbirth labor, okay? So it's a peptide. It's got 9 amino acids in it. And the number of oxytocin receptors in the uterus increases during the course of labor and delivery and then decreases. And we use something similar to it. Like I said, Pitocin, we give fairly much bigger doses of that to help with postpartum bleeding. So we've given, we usually right after delivery open a oxytocin drip wide open. If you gave a woman who was in labor too much oxytocin, you get fetal distress. I mean, there's just too strong of a contraction that way. It's produced in the hypothalamus, so it's pretty near the pituitary gland, but it's also produced independently. So the retina, pineal gland, thymus, pancreas, testicles, ovaries, and even the adrenal gland. So it's a rhythmic thing like so many hormones, and this one peaks around noon. A lot of your hormones peak about 4 in the morning. Oxytocin has a feedback mechanism. It's delivered from the hypothalamus to the pituitary gland, where it then enters the bloodstream, okay? So there's several different oxytocin receptors, and they keep looking at where those are and what they do, so it's not firmly understood what oxytocin does. So oxytocin is affected by a number of factors, not all of which is understood, but it does directly stimulate nerve cells. So it can have almost an immediate effect on your nervous system. It also acts upon the amygdala, which is where your fear responses are, and can sometimes relieve that paralyzing sense of fear that the amygdala regulates. So I've used this in Iraq war veterans who suffered PTSD from being in Iraq. And so many of them would, just very simple little noises would trigger their PTSD. And if they were taking their oxytocin, they noticed that that fear response and trigger wasn't really there. It may be that circulation, or specifically microcirculation, in the small vessels of the body is regulated by oxytocin through production of nitric oxide. And so we'll talk about nitric oxide, I think, later this week, because I've brought it up several times. I've also brought up oxytocin several times over the last 4 or 5 weeks. And I thought, well, we'll just do our own little class on oxytocin. Okay, so the functions of oxytocin. So we talked about uterine contractions and labor. We talked about stimulation of flow of breast milk. We talked about postpartum bleeding, stimulating nerve cells, and possibly relieving anxiety from mood disorders. Also may work in the hippocampus to help seal and establish memories. The other interesting thing is it's been studied for chronic pain and calming inflammation. And you know me about chronic inflammation and chronic disease. Most of the illnesses that we deal with have to do with chronic inflammation. So anything that you can do to reduce inflammation in your body is typically going to help you feel better and be less ill, right? So it appears that estrogen stimulates the production of oxytocin. So oxytocin is probably more active in women, but it is also active in men, which is why the research on oxytocin continues to flourish, because men and women apparently have similar receptors and target areas for oxytocin, but estrogen stimulation seems to give more oxytocin availability to women. Okay, one of the things that we do with men on testosterone replacement is watch their estrogen level. And if it gets too high, because testosterone can convert to estrogen through the effects of aromatase, which is an enzyme that converts testosterone to other things. And one of the reasons I don't like testosterone through the skin, like in a cream and a gel, is that aromatase enzyme is pretty active in the skin. However, if you deplete a man's estrogen level too much, so there's a way to block that if it gets too high. Otherwise, these guys start getting breast development, and they can get nipple. I guess most of them say they're sore. They have nipple soreness. So if you block the estrogen too much, you get 3 things actually. One, it just flew out of my head. One, you can get osteoporosis just like women. I mean, you get a man's estradiol level too low. They can affect bone formation. It also reduces human growth hormone levels, and it also decreases oxytocin levels. So oxytocin may also play a role in regulation of progesterone. Okay, so progesterone is produced in the last half of the menstrual cycle, and seems to be related to premenstrual syndrome, which got renamed premenstrual dysphoric disorder, so that I think Prozac could get another patent for, I think it was Seraphim, which is fluoxetine. Okay, so loss of production of progesterone, if your oxytocin levels are low, can give you tension, mood swings, depression, headache, fatigue, difficulty sleeping, and breast tenderness. Okay, so how's it used other than for what we've already talked about? So there are some normal functions of oxytocin. So the normal functions affect emotional, cognitive, and social behaviors, and it seems to promote bonding. Okay, so the parent-child and romantic bonding. So I said love actually equals oxytocin. That's an attachment function. So if you look at signaling from three different hormones. So dopamine is the reward system, seems to be mediated with oxytocin. Okay, and so dopamine and oxytocin, you typically want in balance, like every hormone thing I talk about. Okay? Too much of it can cause trouble, and we'll talk about that. But the ideal dopamine and oxytocin balance is involved in lust and attraction and attachment. Of course, lust is mainly testosterone and estrogen. Attraction is a dopamine thing, but that attachment, that love, that bonding is from oxytocin. So it's an important thing to have, even for just social situations, people that you're attracted to, maybe not romantically or sexually or whatever, but friendships and marriages and parent-child bonding and long-term relationships are involved with oxytocin and dopamine balance. And we'll talk about too much of both of them here in a minute. Okay, so how do you use oxytocin in problem areas? So it's been used in fibromyalgia, which is also called, to me, chronic fatigue syndrome. That's arguable, but chronic fatigue syndrome seems to be, they used to think it was Epstein-Barr viral syndrome, but it really seems to be at play for people with chronic fatigue and chronic pain. So doctors have used this because fibromyalgia people seem to respond to warmth. And when oxytocin is administered, so if you give a little shot of it, it's like a little test dose, most people will flush. So they'll get this kind of warm feeling all over their body. And if that happens, then you know that the nitric oxide production has been stimulated by oxytocin. So that's the thinking behind the mechanism of action. So fibromyalgic people like warm baths. They think most of the time massage helps. And also they have hours of relief after an orgasm. And of course, dopamine and oxytocin rise normal physiologically during sexual activity and at orgasm. So you get a surge of oxytocin and dopamine. Okay. So if you put people on oxytocin, whichever mode of administration you want, that seems to decrease the symptoms of the chronic inflammation and chronic fatigue of fibromyalgia. So what about pain itself? Okay, so opioids have their problem. We've had this opioid crisis going on for about 20 years. And so there's some debilitating side effects, risks of addiction, abuse, opioids, etc. Okay, many pain treatments being investigated as alternatives to opioids. Okay, and oxytocin seems to be emerging as one of the options for management of chronic pain. Okay, so they've done studies on chronic pain sufferers, chronic pain syndrome, and found they have lower oxytocin levels. So you can actually measure it. There's a lab test for measuring oxytocin levels. And people who have normal oxytocin levels have a higher threshold for pain management. Okay, so appears that oxytocin helps relieve pain directly at the opioid receptors. You remember we talked about the direct effect on nerves. The most interesting thing, what got me sitting up about the Belmar Pharmacy article that I read years ago, like 10 years ago, was this is found to be helpful in autism. Now, I probably do take care of autistic people or have. I just don't, that's not my specialty, or I'm not well versed on autism. But that's what really got me interested in, okay, what's going on with this hormone, since I love hormones. So symptoms of the autistic spectrum include inability to socially bond. They're kind of physically get away from me. They don't like being hugged, physical touch, even making eye contact. So they looked at this in children and adults, and those people were found to have low oxytocin levels and kind of low functional oxytocin receptors, and sometimes enzyme conversion problems needed to activate oxytocin. They can also have unremitting inflammation. Okay, so you can measure that in blood tests. So oxytocin seems to have a calming effect in that inflammation. Plus, it helps with that social bonding. Remember the attachment we talked about. Okay, so mood disorders. It's a rapid effect on the brain from oxytocin. Lots of oxytocin receptors there. So a lot of mental disorders may have a component of deficient oxytocin levels. Learning and memory we talked about might be enhanced by adequate levels and may relieve difficulties in social situations and high anxiety, etc. Figuring out how to dose it is kind of the art to this. And most doctors have used oxytocin if they deliver babies, but they've never used oxytocin for these other areas. So figuring out how to dose it, I'd say most doctors wouldn't know how to do that. Without studying, you can study, right? Okay, what about high blood pressure and heart disease? Well, we talked about nitric oxide when we went through the cholesterol effects on mortality and heart disease and finding out that a lot of those people are nitric oxide deficient. And oxytocin helps in the microcirculation for development of nitric oxide, which is produced in the endothelial cells of arteries. Okay, and so it's possible that prevention of atherosclerosis may happen if you have adequate nitric oxide production in the blood vessels. So if oxytocin lowers or estrogen levels are lowered, that may have a direct effect on the development of atherosclerosis. And so maybe before putting people on statins and all kinds of meds, you could potentially treat as a preventive thing with nitric oxide or oxytocin and making sure those are at adequate levels. Okay, the other thing that I've used this for, so I've used it in addiction medicine. So one of the fights I had with the Oklahoma Medical Board was me using these, what they considered weird and off the chart uses, even though the literature goes back. The articles that I used for management of addiction go back to 2012, I believe. And so the vast majority of the patients that I had that were chronic opioid abusers or addicts and dependents were on Xanax. And of course, the FDA issued a black box warning on the combination of an opiate and Xanax or any really benzodiazepine in August of 2016. So I had to get all these people that were on Xanax and Klonopin and Valium off of their benzodiazepine if they wanted to continue to be treated with buprenorphine, which is an opiate used for addiction medicine, medically assisted treatment. And I used oxytocin on quite a few of them, and it worked. So you just got to figure out the right dose. You got to play around. You got to individualize every person almost on everything that you use, specifically on hormones. So the other way I used it was mixing it with apomorphine in men with erectile dysfunction. I'm not going to say every person that took it got rid of their erectile dysfunction, but they certainly did increase their sexual desire. And if we could maintain an erection on them, they had a better orgasmic experience. So oxytocin used clinically in men for erectile dysfunction and orgasm, and then for women that have inability to achieve orgasm. And we can have a whole nother class on how common that is. Okay, so what are the symptoms of oxytocin deficiency? Okay, so what would tell you maybe I have an oxytocin problem? Okay, here's a little list. Lack of warmth in social situations and social isolation. Well, what have we been doing? All right, so social isolation decreases oxytocin levels. Okay, absence of smiles. People just have nothing to smile about. Okay, a lot of that going on in the last 2-3 months. People that are easily disturbed by other people, a low sex drive, less intense or inability to have orgasms, lack of ejaculation has been tied to this, pale skin, cold hands and feet, muscle tension, flank pain, and hypertension. So we talked about excess oxytocin. Let me flick back over here. Okay, so what would be bad? So if you have too much dopamine and oxytocin, remember dopamine is the basis of all addiction. So I'm not going to say this is all oxytocin per se, but I did find out when using oxytocin, if you not overdose, but if you use too much of it, then people get irrational. They start getting more anxious and they start getting more irritable. So that, as usual with everything, there's a sweet spot. You got to figure out as a clinician where that person's sweet spot is, get them to that sweet spot, and then maintain them there. So too much dopamine, too much oxytocin, binge eating, drug abuse, irrational behavior, adultery, jealousy, prejudice. Okay, so once again, there's too much of a good thing becomes a bad thing. So the ideal levels of oxytocin and dopamine have to do with attraction and attachment, and then your lust, your feeling of lust, and there's one of the 7 deadly sins, is testosterone and estrogen, specifically testosterone more so than estrogen. Okay, so too much of a good thing can be bad, right? Recent studies on ecstasy, MDMA, or Molly as it's known now, shows that oxytocin may be the hormone behind the feel-good and social effects those chemicals produce. So ecstasy was developed, MDMA, and I can't remember the chemical name, and I'm a chemist, or I have a chemistry degree, and I never remember that one. Ecstasy, the street name, was developed for treatment of post-traumatic stress disorder in Vietnam War veterans in, I think, the late 70s. And it worked well. And then it became part of the rave scene in Dallas, and then they started mixing with different things. And then MDMA wound up being a category 1 on the DEA controlled substances list. Okay. So if you have too much excess oxytocin, I don't know that I can think that I've ever seen anybody that has just de novo in their own body excess oxytocin, but there can be some relationship problems with the jealousy and the codependency, etc., excessive expressions of love, excessive sex drive, potential, I guess, for sex addiction, if you believe in that, and that'll be another class, because I don't necessarily think there's such thing as sex addiction per se. Although I've met people that made me think about that. So what's the dose? So typically it's 10 to 40 international units per day. For me, when I was using it in addiction medicine and for the erectile dysfunction guys, I would give them about 50 international units. The sweet spot seems somewhere between 10 and about 60 per dose. And of course, the people that were, really benzodiazepines are addictive, and most of the patients I took care of were on escitalopram or Xanax 3 times a day, sometimes 4 times a day. So I would dose these people about 50 units, usually as a nasal spray or as a lozenge 3 times a day. If you get up to 200, that's when you have the excessive oxytocin problems. Okay, so for fibromyalgia, usually 10 to 40 international units per day, and even doses as low as 5 international units in the morning. Smaller doses used in autism in children. And if you're interested in better orgasmic capability or a better orgasm, you add another 5 international units to whatever you're taking for whatever other reason. So really low dose oxytocin for sexual dysfunction. 50 would be considered kind of the top dose for using that. And really, if you look at, I'm just going to read you, and then we'll be done. I'm going to read you some of the clinical research, just the topics. Okay, so research on oxytocin and sexual function in relationships, okay, enhances brain reward system responses. In men that view the face of their female partner, just looking at the face of their female partner, okay, that can be improved. Oxytocin during the initial stage of romantic attachment, the orgasmic history of oxytocin. That one was done in India, 2011. Acute effects of intranasal oxytocin, so nasal spray on endocrine and sexual function in males, etc., etc. Post-traumatic stress disorder. Here's an article from two articles from 2014. So effects of oxytocin on working memory and executive control in PTSD. Oxytocin administration early after psychotrauma to prevent the development of PTSD. That's a randomized controlled trial. Mood disorders, intranasal oxytocin and anxiety and depressive disorders, use in borderline personality disorders, social relationship studies, oxytocin and brain activity, enhancing behavioral synchronicity via the anterior cingulate cortex. So that's right above the pituitary and the hypothalamus in the brain. So there's tons of those. Going back, let's see, 2007, I'm seeing one. But most of them, I'm going to say within the last 10 years. Weight loss and obesity, so oxytocin and metabolism, implications for obesity and diabetes, regulation of food intake based on oxytocin levels, potentials for obesity treatments, eating behaviors, eating disorders. Then autism goes back 2015, 2018, 2017. Belmar Pharmacy, basically, I read about oxytocin, I think it was about 2010. And then the fight I have with the Oklahoma Medical Board, addiction. So the first ones I saw 2012, 2013, use of in alcohol withdrawal, in alcoholism. Oxytocin reduces cocaine seeking, association between oxytocin and novelty seeking among methadone maintained heroin users. Oxytocin on withdrawal craving and stress response and heroin addiction. In pediatrics, there's one from 2014, the pain ones, and then one of the newer ones, really, 2017. Oh, no, this one goes back to 2011, is reversal of vaginal atrophy. So it actually rebuilds the tissue, the vaginal mucosa in the vagina for postmenopausal women that have vaginal atrophy. So its uses are kind of amazing, and I'll bet not one of you have ever talked to or heard of a person that has been on oxytocin except while they were in labor. So it's a cool hormone. It's known as the love hormone and the cuddle drug. Now you know. I'll post up those research things for those of you, and they're clickable. Those of you that like to read science, I'll put that up in the comments when I get done. And I will see you Wednesday. I think we'll talk about nitric oxide, which is closely related. And you know that now that you heard this little class. I'll see you Wednesday. Have a great day. It's beautiful outside. And peace and love to all of you. See ya. Bye-bye.